Welcome to Your Healthcare Matters. I'm your host, Jenna Sims, and I've worked in healthcare for over a decade. And like many of us, I'm really concerned about the deterioration of our healthcare system. On this podcast, we interview patients, healthcare professionals, and advocates to provide unique perspectives and helpful tips for navigating our failing healthcare system. My goal is to inform, connect, and inspire listeners to take your health into your own hands. So my guest today is Sharman Minus. She first started volunteering with BC Healthcare Matters in February of 2022 at their petitioning event outside the BC legislature. Since then, she's helped with demonstrations and rallies, distributed lawn signs, and served as the vice president of BC Healthcare Matters. Sharman supports the intention of the Canada Health Act for government at all levels to provide Canadians with prompt access to essential health care with the professional of their choice. Thank you so much for joining me today, Sharman.
Thanks, Jenna.
Great. So we'll just start off by asking you to tell listeners a little bit about BC Healthcare Matters and what motivated you to become a volunteer in the first place.
BC Healthcare Matters is a grassroots, really from the ground up organization that was started in January, February 2022 by Camille Curry, who was quite shocked at the lack of healthcare that was available considering her family's illnesses. She put out some Facebook posts, which I saw in January, and I had been thinking that something needed to be done. And so I connected with her and we took it from there. Many other people have joined and volunteered with BC Healthcare Matters, and it's a going concern.
And what sort of sparked that fire within you to have that need to want to join her organization in the first place?
I've, at that point in 2022, I had over five different doctors.
Oh, wow.
And I had never left them. They'd always divorced me, usually because they were going back to their original province, or they were going to do a further education, or they were just giving up their family practice to be hospitalists. And in 2020, although as an older woman, I'd had mild blood pressure problems for several years. I wasn't really too worried about my health, although there was a history of heart disease in our family. But in 2020, I had a heart attack. And it took me, because it was the beginning of COVID, literally the beginning when we were really locked away in our homes, it took me 4 days before I decided that, yes, I really had to go to the hospital.
Oh my goodness.
Yes.
Wow.
And so it was an emergency operation. And that shook me to my core, changed the whole way I'm going to live my life, the way I look at myself, etc.
Right.
Once you've had your operation, you do need to have a family doctor. Now, there was one very overworked hospitalist who is assigned to you for a year. And of course, you have your cardiac specialists, but you do need a doctor to be doing tests and regularly monitoring you. And I could not find one, and it worried me sick.
Right. So you didn't have a family physician in 2020 when all of this happened?
No, my last family physician had retired in 2019.
Oh, wow. And so you had mentioned that you had had 5 physicians. Over what timeline was that?
From 1998 to 2020.
My goodness. Yeah, yes, that's quite a few switching back and forth, isn't it? Yeah. And do you have a family physician now?
I do. Thank goodness.
It's been about time, right?
Yes, it is.
And can you tell me a little bit about what kinds of things that you've done for BC Healthcare Matters?
Well, I've helped organize demonstrations and the rallies. I've become that person that stands on a corner and approaches you with a leaflet.
Oh, no, not one of those.
One of those. Never thought I would. But I have done that. That was how we first started, by handing out leaflets outside the legislature to people. And I've done a lot of research online. I've given a few speeches at some of the rallies and meetings.
That's great. And what do you feel like you learned from these experiences as being an advocate?
I think one of the first leafleting we did, I learned so much from that, approaching people. And our first question was usually, do you have a family doctor? And consistently, over the 6 months that we did that, 80% of people said they did not.
Wow.
Of all ages, young people, middle-aged people, old people,
Mhm.
80%. And so we began to think there's much more of a problem than we thought. And this was
Right.
before really official figures were being floated around. And of
Mhm.
course, it's come to pass that, yes, everyone now knows that 20% of BCians do not have a family doctor
Right.
or
Right.
healthcare provider of their choice.
Yeah. Yeah, that's a staggering amount, isn't
Mhm.
it? And what are you hoping to accomplish by being a healthcare advocate?
Well, I would say that since 2022, BCHCM has accomplished an awful lot. At that time, my only hopes were to get healthcare uppermost in people's minds, and so that they would know how to appeal to their leaders at every government level to make positive changes. And we've done that. I would say that through the press coverage of our rallies and demonstrations, interviews with Camille, our speeches, our leafleting campaign, letters to the editor, social media feeds, etc. I think we've educated hundreds of thousands, if not a million,
Oh,
of our
wow.
citizens.
That's great. And so it was really a focus of education for BC
Yes.
Healthcare Matters then.
Yes.
Yeah, that's fantastic. So hopefully we'll reach an even wider audience with this, right?
I hope so.
Yeah, because it's sort of one of those things that you don't know how important it is until you need it.
Mhm.
And if you need it and you can't access it, that's when it becomes a real problem.
It does.
Mhm.
I think I have mentioned in the past that our social media pages are quite often the question they pose is, "Oh, how can I get a doctor in Victoria?" And it's laughable that the answer is always the same: try hard, but it's going to be an uphill battle.
Right. Yeah. No, it's really become a crisis, hasn't it?
It has.
Yeah. Can you tell me a bit more about your support of the Canada Health Act and how you feel it impacts us?
Yes, I did a deep dive into the Canada Health Act, which is many, many pages of legal language, and I tried to summarize it as best I could. It is actually on our website. So if you excuse me, I'm just
Sure.
going to pop my glasses on here
Sure.
to read a few
And
things.
which website is that?
That's the bchealthcarematters.com
Perfect.
website. I feel that over time, the province has deviated from the intention and the spirit of the Canada Health Act. And the Canada Health Act wasn't written as a set of specific laws, but more suggestions for good governance in healthcare for each province. And there are 5 criteria that they set out: public administration, comprehensiveness, universality, portability, and accessibility. I think BC has problems with 2 of those, and that's public administration and accessibility. Public administration is the administration of funds to create a viable healthcare system for the province. How is it done? It has to be nonprofit, and the people who are administering those funds have to be accountable, and records and accounts must be publicly audited. I don't feel that any of that is happening right now in the province. There are many stories of reporters who've asked direct questions to get information about certain public healthcare systems or answers about public healthcare, and they've been told, well, they just not told, so they even submit freedom of information requests, and those come back so redacted it's ridiculous. You don't get any information
Oh
from
my
them.
goodness.
These are our taxes. This is our money. There's money given from the federal government to the province. This is money that should be spent on our healthcare and spent wisely, and somehow we are not allowed to see what is happening. I find that unconscionable.
Right. So you're really pushing for more transparency.
Absolutely more transparency. The other thing, the last, is accessibility. And it was meant to be accessible, reasonable access, but unimpeded by any charges. And there should be no discrimination on the basis of your age, your health status, or your financial abilities. Now, for one example on that, telehealth, as far as accessing. I mean, telehealth, I can see, is one of the pillars of a rounded healthcare. Well, rounded healthcare. There's many different aspects. It's not just going to a single family doctor all the time. But if you think about how people are relying on telehealth, It hasn't taken into account people who aren't comfortable with Zoom-type meetings,
Right.
which tend to be the elderly. So we're leaving out a great swathe of people.
I feel like that's a great point that a lot of elderly citizens may not have the knowledge or understanding or the devices to enable them to use telehealth for the Zoom calls. So I think that's a great point.
I agree. And the other point is, as far as financial, wait times for many tests and scans are far too long. If you have a fast-moving cancer, you cannot wait 9, 10, 12 months for a certain scan. And I've found personally and through our websites and social media where people write their stories, I've found that people are saving up or they're just going to pay outright for a scan that should be free under our Healthcare Act. I think that's not at all in the spirit of how the Act was written.
Right, because it sort of creates inequality based on financial status. So those that can afford to pay can cut the line essentially by going to privatized healthcare, whereas those who cannot languish and wait in that line.
And it's interesting you said cut the line, because the general response is that, oh, well, if they've cut the line, they're out of the line now. They're out of the line, so we'll all shift up so many positions. It doesn't work that way, because there are a finite number of technicians and machines, et cetera, et cetera. They're not cutting a line. It's not like they have that. Those offices and that are also doing scans for people under who are insured. They don't cut the line. They just go to the head of the line.
Right. And then we sort of go down that slippery slope, like in the US, where we have two different healthcare systems.
Yes.
You've got an impoverished public healthcare system, and then you've got this higher end system for those who can afford it. And as a healthcare provider, if you're getting paid better by the private system, that's where a lot of those professionals are going to go. And you're right, there's just a finite number of healthcare providers. So if we end up with more in the private system than we have in the public system, then we end up with an even bigger backlog of patients who are not able to get medical scans and different services provided in a timely fashion, right?
Absolutely right.
Great. So I do have a question for you. If I was to hand you a magic wand right now and you could just wave it and fix one thing in the healthcare system, what would you change?
That's difficult, because I think the problems are like an octopus with many tentacles. But something that I think would be fast, we need doctors. Something that I think could be a fast help would be if we pulled down all the barriers against Canadian citizens who've gone abroad to get their medical degrees. Currently, it's the hoops they have to jump through are ridiculous. It takes far too long. Someone who's born and raised in BC and has, say, gone to Ireland to get their degree has to take an English proficiency test. I mean, that's one of the silly criteria they insist on.
Even if they're a Canadian citizen?
Even if they're a Canadian citizen.
Wow.
And they've gone to an English-speaking university. I mean, of course, we need to vet people. Well, that can be done these days. I think you would get so many of them want to come back. And the reason they went to a foreign medical school would be because we don't have enough positions in medical schools in BC. Those were cut over many years. We aren't producing enough. It doesn't mean that, well, they didn't pass the strict academic standards. Their academic standards. In some cases, they went to countries where perhaps their medical schools are better. I think if you could encourage those people to come, make it easy for them, that would help a lot.
Right. So your magic wand would create that pathway for Canadian-born citizens that have studied abroad and would like to come back to Canada to practice.
Yes.
Just to make it a lot easier for them to return to their own country to practice and help here.
Yes.
I think that's wonderful. So my final question for you is, as regular citizens, what can we do to advocate for positive change within healthcare?
As regular citizens, I would encourage all citizens to become more aware, to educate themselves, to read newspaper articles, to be aware of all announcements that are made from government. I would also urge them to look at everything through the lens of a skeptic, especially government announcements. They can write to their MLA. They should be writing to every level of government to do something positive about healthcare, because we can't continue this path at all. And finally, I think that we should be holding them responsible for poor outcomes and demand transparency from our leaders.
Yeah, I absolutely agree. Well, thank you so much for joining us today, Sharman. That was a wonderful conversation. Remember, together we can advocate for the healthcare that we all need. Thank you for listening. The content provided on Your Healthcare Matters is for informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical concerns. The opinions expressed by guests are their own and do not necessarily reflect the views of the podcast or host.